through this relatively quickly. I am going to be in the room, obviously, until about 7 tonight, which I hope you will too. So you can ask me any questions if your question didn't get answered at the end of this, or if you want some further answers. We have our full strategic 3-year plan is on our website, where you look under annual report. It's right there. So this goes into more detail, but this is just skimming the surface of what Accenture did with us. And they really went through the full market scan of the mental health sector as a sector in Canada, and what Healthy Minds Canada's current assessment was, and where we thought we could go together. This was very comprehensive. This worked not just with staff, but really brought the board involved, so that this is the board's visioning exercise with a little bit of staff on how to execute it, right? So this is a broad visioning and a lot of Accenture saying, here's what's really needed. Here's the white space in Canada, which for us, it really meant that thanks to places like, well, thanks to us, Healthy Minds Canada, and other organizations, and Bell Let's Talk, really, in 2009 and 2010 with their first Bell Let's Talk Day, changed the landscape of mental health awareness in Canada. And so a lot of what we are doing, mental health awareness, isn't really solving it's not a solution anymore, right? There's a lot of people are aware that a problem exists. What we really need to focus on now is getting people the help they need faster. People are now navigating a system which they find confusing, full of wait times, full of dead ends, and full of bureaucracy. So how do we, well, provide the resources on our website and guide people to the areas that they are customized to fit them? So I don't want to jump too fast forward, but these are a list of our strategic goals. I'm not going to read through them. Again, they're on our website under the main plan, and they're also on our website under the About Us with our, as I mentioned earlier, our new vision, mission, and mandate. So we are really here to be the main backbone of this journey. Awareness and education, which is really early identification, journey navigation, and ongoing recovery support programs. These are the 3 pillars of Healthy Minds Canada today. Now, in the awareness and education, the early identification, that still encompasses our Lunch and Learns, our Bell Let's Talk, all the programs that I mentioned before. What it also is going to include is a tool that, thanks to Feeling Better Now and the team at Mansente who are here in the house, woohoo, we have renegotiated our relationship with them, so that what we'll be doing very soon, and we've done part of this recently, is changing the flow on our website. So the main thing is people come to our website and they think they need help for themselves or for someone else. They can fill out an assessment. It will give them a customized toolkit. It's all DSM-5. This is non-diagnostic, but it guides them into the area where they can best find the resources suitable to them. Gives them the customized toolkit that's curated by the great people at Feeling Better Now, and also enhances those resources with our Healthy Minds Canada customized resources that they can then go off and use themselves. So they're really being the navigator and the driver of their own mental health care plan. It also feeds a report to their doctor, so that they can then have that conversation with the healthcare provider that they work with, and or team, if there's a team. So that this does, like Jonathan was saying, this doesn't happen alone. You need a team around you. And whether that's through organizations and resources that we pull together, including peer support or awareness raising events or additional community supports, or an actual medical licensed care provider, this is all going to be done through there. And then ongoing supports, and this will be a little bit of more sort of some of the stuff we're working on now, and some of it is kind of to be redesigns of our website, so that it's not so menu, I'm going into a little bit of the weeds, but not so menu driven anymore in terms of where you go for help, but a lot more of the user directing themselves to where they're going. If anyone's ever been on the Kids Help Phone website, All it does on the main screen is say, how are you today, or how can we help? And the young person, or whatever age the user is, can fill that in, I'm feeling lost, or whatever generic language they use. And there's coded words, so a little bit, not quite artificial intelligence, but a little bit of smart programming in the back end that will then populate the next page with all the resources that are customized to that search. So it makes for a better user journey. Here's where we're seeing some of the feeling better now. So again, to meet our mandate, which is in that fine print on the big slide that I showed you before, but it's on our website, we're working with Mensante. And we find that this is the best tool out there. Trust me, I've looked at a number of them, and I've also looked at ones in the States too. This is a made in Canada solution, and by far the best, and they work with a lot of companies, and we've been very fortunate to have a good relationship with them, and now to have a special, unique relationship so that we're able to offer this tool and this journey for your own healthcare to our community. And we're not a membership organization, so this is really driven through by coming to our website. As you can see, the stressed, anxious, depressed assessment, view your action plan, self-care, and you can view all this without creating a profile, or you can choose to create a profile and then monitor your progress as you go through. So this website here will be, once you've sort of decided you're going to do the assessment, this part of it is a little bit more embedded within the tool, but I put it there to not have to flip through so many slides. And then you've got your start assessment with you can see up here if you're coming back again. And you've got your resources, supports, mental health literacy, contact us. And these are some of the tools and how you'll search for them. So web, smartphone, self-care monitoring, health essentials, care map for depression, and that's just one example, but everything in the DSM-5 is there. And this one I'm really excited about. Chris Hobson is in the house, a little over there, and Stephanie Friel are two members of the team, and Christophe is on the team as well, has been helping us with this app. And this is for peer support. And so what we've been finding through a lot of research is that people-powered health can and does save public healthcare systems huge amounts of money. The UK has done studies that it can save up to $14 billion in their healthcare system alone through people-powered connections. Similar studies out of the US. There are really no comparable studies in Canada, but alcoholics exist everywhere and addicts exist everywhere. And so this tool is originally going to be designed and piloted in the alcohol community, and then move to the wider addictions, and then eventually mental illness to cover peer support within the mental illness community. And it really, within addictions especially, and also within peer support, you can see here that the Mental Health Commission of Canada backs this up in finding peer support as an extremely helpful way to get people the help they need. People relate to people who have shared that similar journey. That's a key ingredient in getting people staying in recovery, whether it's keeping on their medications, if medications have been prescribed, maintaining their behavioral therapy or their lifestyle changes if that's what's needed, staying sober, staying absent if that's what's there. And so we're facilitating this app in the initial stages. We'll facilitate that sponsor-sponsee relationship. It's like a dating app, but to connect to a sponsor. So if you want to be a sponsor, it's going to hook you into a sponsee. If you are a sponsee, it's going to find you a sponsor. So you can build a mentor, a coach type relationship, and create communities of support networks, and then offer a lot of resources on there. Like even things as simple as where do you have your first meeting with your sponsor? What do you say? What do you talk about? What kind of workflow? What are my goals? How do you articulate your goals to your sponsor? And this is what our original, very basic designing looks like right now. So I've actually got the incorrect screenshot up there, but right there you fill out a couple of quick things like just your postal code, so we can generally figure out your gender, a little couple of quick data points, but you're not yet creating a profile. And then you go, I want to be a sponsor, or I'm looking to be a sponsee, and then it pulls up all your matches, and it's blurred out in a probably not so drastic a way here, but all it shows is that look at the potential behind here. Now it gets you to create your profile. So we hook people in, They create their profile, gives them a little avatar thing. We've created some profiles here. Here are your top matches, and you can connect with either one of them, or you can click to see more. So we are hoping to be working with a team called Pivot to design and develop the actual app. And here's our roadmap and milestone. So we're excited for this. This is a huge undertaking. So I've already started on the funding proposal steps. I've got a pitch deck and I'm working on that, but I'm very excited for this to go forward. But we've really got a great team behind us. And so right now it's people-powered on the development team, and the goal is to make it a people-powered solution. Antidote, which is what I mentioned at the beginning, is a tool where you can, it's similar to the peer support app, but instead of finding someone to be your sponsor or sponsee, it's finding clinical trials in your neighborhood. So that what we want is to raise people's awareness of treatment options available to them, especially for people with perhaps treatment-resistant depression, or people who are finding they're outgrowing their medication, or that the medication has stopped working. This provides for options. You can see what's available out there that you might want to try, and tools to how to communicate with your care team, like your doctor, your care providers, your peer support workers, coaches, whoever you're working with, to make sure that's the right solution to you. So some trials require a doctor's note and some don't, and so we're going to give you, the user, the tools in order to have that and be armed with that. And like I said, these are really ambitious goals. I'm really just scratching the surface here. We're going to be working over the next couple of weeks to develop a big fundraising and marketing plan and get the message of our new goals out of here. And we're excited for it. I'm excited. I'm probably not showing my passion as much, but watch me win the rooms. If you want to get into a one-on-one with me, I'll become super animated because I really am excited about all these. And then this is the final slide. It's not the final, but we need your money to do this, so you better give us money. And the #1 way you can do that is by coming to the silver dinner and showing up and paying up, and that's good. And maybe even asking a company or two that you know to come and be a sponsor. We like them. And then this is where you find us. And again, I promised I would be around for Q&A, so I'm here right now. You can ask me anything you want, and I'll also be around. And we've got staff around too, and board members who you can ask.